Hello, let us continue with the play therapist videos. In this next video, you will be observing our play therapist conducting an acclimatization visit with our patient on the process of taking blood. Let us see how she introduces this uncomfortable procedure to our child patient.
Okay, Meredith, are you going to be a doctor or nurse now?
A doctor.
You're going to be a doctor. What shall a doctor do? What's the doctor going to first? Oh, feed the giraffe milk. Okay. Gluk, 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 gluk.
Quack.
Refreshing. Okay, which one would you like to do first?
Make some more milk for the baby.
Although it almost seems like we were just playing and not progressing with the acclimatization, building rapport is a very important part of managing children. The time spent talking about the child's interests, such as a favorite cartoon or her best friend in school, is time well spent down the road by building trust and confidence.
So, Dr. Meredith, what are you going to do first? Are you going to do the checkup first, or are we going to do the IV plug setting?
Check out first.
Checkup first, okay. That's the stethoscope. Okay, stethoscope. I'm going to check the giraffe. Can you find the heartbeat? You know what? You were very quiet and you could actually hear the heartbeat, I'm sure.
I just hear a little sound of it.
You could hear the sound? What did the sound like?
Oh, boom, boom.
Okay. What's this thing called? Oh, is it for our nose? For our ears? For the mouth?
Oh, yes.
For the ears, okay.
Sometimes, it gives a child a sense of control when they're given choices. You notice our play therapist giving the choice of, would you like to do the checkup first or set the plug first? Which are choices that have no negative consequences. Both has to be done in the session. Try not to ask questions that give the child an opportunity to say no. For example, do you want to do the checkup? Do you want to open your mouth for me? This can result in a loss of control by the healthcare worker. Additionally, you can see some positive reinforcement, with the play therapist providing verbal praise on how quiet the child was being.
Okay, I will show you how it's done first, okay? First, can you help? You become my nurse for a while. Okay, can you help me open this?
Okay.
Okay, thank you. What does it say on the... It says alcohol swabs, 70% alcohol.
This is two here.
Ah, very good observation. You actually see the tear. Okay, we're going to ask giraffe first. Which hand does giraffe want to be poked? Giraffe, which hand? Right hand or left hand? Oh, Dr. Meredith says left hand. Okay, Dr. Meredith, wipe. To clean the skin, we got to wipe. Okay, we're going to wipe somewhere around here, right? Okay. See, Dr. Meredith using...
Wet.
Make it really clean and nice. It feels so cold, says giraffe. It feels really cold. I'm scared. It's okay to be scared. It's okay to be scared.
I think giraffe say that.
It's done. Okay. Now we're going to use this purple strap to tighten a bit.
But
Yeah.
tighten.
Oh, the other way around.
Because giraffe say.
Good. You're putting it round and round. Let's ask giraffe. Giraffe, is it too tight for you? Giraffe here. Okay, we are going to do, what we're going to do, we're going to find the vein. Okay, let's find the vein. It's so small. The veins are so small. Are you able to see? Where's the vein? Usually the doctor will poke. There's the vein.
I think I found it.
You found it? It's going to be here? Good spotting. You found it. Very good observation.
You can see our play therapist getting the child involved in the process, giving her tasks to complete. Building a narrative to engage the child can make scary or uncomfortable procedures more tolerable to the patient, using the process of distraction. Of note, there are some words the play therapist substituted to make the procedure less scary. For example, replacing needle with poke. Can you think of any other words to replace needle or shot?
Shall Giraffe look at it while you're poking or look away?
Look away.
Look away. Giraffe, would you like to look away? Okay, I think Giraffe wants to look away as well. So we look away.
Okay.
Giraffe say, can you please count to 3 before you poke me? Let's count to 3.
1,
1,
2,
2, 3. Ah, pain. It's okay, Giraffe. You can scream and shout, but don't move your hand.
When a procedure is going to be painful, do we tell the child? This is a difficult question, and unfortunately, there is no right answer. I do not believe that telling a child that getting a shot is not going to hurt is a good idea. This can break the trust that a child has for the healthcare worker and make future encounters more difficult. However, overplaying the pain factor can spook the child and make them unwilling to go through the procedure at all. For me, I tend not to use the word pain. I tell them that the procedure is a little uncomfortable, but it will only last for a short time, and distract them in the meantime with lots of questions about things they like. So much so that sometimes they don't even know that the procedure is already completed.
Okay, can we have the splint and the micropaw?
Splint.
Mm-hmm.
What splint?
This is the splint.
Oh, okay.
Okay, so that Giraffe won't move its hand so much. But we know we've forgotten something.
What?
We forgot to take this out. Haha, very good.
Okay, now let's put this on.
Where shall we put this? Underneath here or on top? Baby doesn't have a splint.
Oh yeah.
I think we put it underneath. Good idea. So the hand won't move so much. Alright? So can we have the micropaw?
You mean the tape?
Yep, the tape. Micropaw tape.
Here, the play therapists use some terms that seem so routine to us, such as splint or micropaw. However, you will notice that the child does not understand these terms. Be aware that even simple medical terms can be confusing to a 5-year-old. It is thus important to simplify your vocabulary or explain the terms to the child in words that she will understand.
Okay, before we do that, what must we do with the blue plug?
You.
Must clean first.
Oh, clean.
Clean with the alcohol swab.
Yes.
Clean.
Okay, I think.
Good job. Okay.
Now.
Okay, let's tell Giraffe first what's going to happen, okay? We feel something, like you feel something going through your veins because Dr. Meredith is taking some blood. It's okay. You want to look or you want to look away? What do you think Giraffe wants to do?
I think he wants to look away.
No, look away, okay. Let's count to 3 again. Do you need help?
1, 2, 3.
Draw. Very good drawing blood. Oh. Okay, let's unscrew it, okay?
Now. That.
Ta-da! You're done. Good job, Dr. Meredith.
That was a great interaction with a child role-playing an uncomfortable medical procedure. I hope it provided you with some insights.